1942, the United States Pharmacopoeia quietly removed over 80 botanical medicines from its official register in a single decade. They were not removed because they stopped working. They were removed because the pharmaceutical industry had something newer to sell, and the institutions that approved drugs for American families had already decided that newer was the same word as better. Number 7 on this list was used by every farm wife in America to settle digestive trouble for 2 centuries before Pepto-Bismol existed, and gastroenterologists at major teaching hospitals are now publishing papers on the exact mechanism your great-grandmother understood by feel. Number 14 was so common in rural medicine cabinets that the United States Army included it in standard-issue field manuals through 1953, and it cost less than a quarter to make it home. Number 3 contains the precise chemical compound that became aspirin, but your great-grandmother extracted it for free from a tree growing in her own backyard, and she did not need a chemistry degree to do it. These 20 home remedies kept American families alive through epidemics, world wars, and the deep poverty of the rural depression years before there was health insurance, before there was a pharmacy in every town, and before there was a doctor within 40 miles of most farmhouses. Your great-grandmother did not have a medicine cabinet the way you understand one. She had a kitchen, a garden, a few jars of dried herbs hanging from the rafters, and a memory full of knowledge that her own grandmother had taught her, standing at the same stove. None of it was magic. All of it has measurable, repeatable, scientifically documented mechanisms of action that modern phytochemistry can fully explain. We did not stop using these remedies because they failed us. We stopped using them because somebody figured out how to bottle a substitute, patent it, and sell it for $40 an ounce. Hit subscribe before we start. What you are about to learn is not folklore. It is the lost half of American medicine, and the most prestigious hospitals in the country are quietly bringing it back one peer-reviewed study at a time. Let us count them down. Number 20, the onion poultice for chest congestion. When a child came down with croup or a deep chest cold in 1925, your great-grandmother did not drive to a pharmacy because there often was not one within 40 miles. And even if there was, the family did not have the cash. She walked to the kitchen. She sliced 2 large yellow onions, warmed them gently in a cast-iron pan with a spoon of lard until they were soft and steaming, wrapped the entire mass in a clean cotton dishcloth, and laid it directly on the child's chest under a heavy wool blanket. She replaced it every 20 minutes for 2 hours. By bedtime, the cough loosened, the breathing eased, and the fever broke. The mechanism is not mysterious. Onions contain quercetin and a family of sulfur compounds called allyl sulfides that have documented anti-inflammatory and mucolytic properties. The warm, moist heat opens the airways and increases circulation to the chest wall. The volatile compounds penetrate the skin and reach lung tissue in measurable concentrations. A study published in the Journal of Agricultural and Food Chemistry confirmed the antimicrobial activity of crushed onion against multiple respiratory pathogens, including streptococcus and influenza. 2 onions cost 50 cents. A bottle of children's chest rub at the modern pharmacy costs $9 and contains petroleum jelly, along with synthetic versions of the same essential oils your grandmother had on hand for free. The onion poultice was retired from American medicine, not because it failed, but because nobody could put a corporate label on a vegetable. Number 19, the saltwater gargle for throat infections. When the family woke up with sore throats after a hard winter night, your great-grandmother boiled a kettle, dissolved a heaped teaspoon of plain table salt in a cup of warm water, and made every child gargle for 30 seconds before breakfast. She did the same thing again at noon and again at bedtime. Within 2 days, the soreness was gone and the infection had cleared. The mechanism here is osmosis, pure and simple. Salt water draws fluid out of swollen throat tissue, which reduces inflammation and physically flushes bacteria from the back of the throat. The high salt concentration also creates an environment where most bacteria cannot reproduce. Modern hospitals still recommend exactly this remedy for post-tonsillectomy care and routine pharyngitis. The American Academy of Otolaryngology lists it as a first-line treatment for sore throat. A 26-ounce box of plain salt costs $1 and contains enough for hundreds of treatments. A bottle of throat spray at the drugstore costs $12 and contains the same active ingredient diluted in propylene glycol with cherry flavoring. Your great-grandmother did not need the cherry flavoring. She needed the salt and the kettle, and she had both. Number 18. Cobwebs to stop bleeding. When your great-grandmother cut herself on a kitchen knife, or a child came running in with a deep scrape from the woodpile, she walked to the corner of the barn, gathered a handful of clean, dry spider web, and pressed it firmly against the wound. The bleeding stopped within seconds. The web held the cut closed long enough for clotting to do its work. This was standard frontier first aid documented in medical texts, going back to ancient Rome, and it persisted in rural American medicine well into the 1940s. The reason is real. Spider silk has a fibrous structure that promotes platelet aggregation and contains vitamin K and trace antibacterial peptides that researchers at the University of Akron have been studying for surgical wound closure applications. The same property that makes a spider web catch insects makes it ideal for binding a wound. The cost was nothing. The only requirement was a barn, an attic, or any neglected corner of the house. We replaced the cobweb with a sterile gauze pad and a tube of antibiotic ointment that costs $8 together. Your great-grandmother got the same biological action from a corner of the room she walked past every morning. Number 17. The cabbage leaf compress for swelling and inflammation. When your great-grandmother sprained an ankle, twisted a knee, or had a swollen joint after a long day of harvest work, she pulled a fresh head of cabbage from the garden, peeled off the largest outer leaves, crushed the central rib with a rolling pin until the cell walls broke and the juice began to weep, and bound the leaf directly onto the swollen area with a strip of linen. She left it on for several hours, replacing it every time the leaf wilted from absorbed heat. The swelling went down faster than it had any business going down. The mechanism involves natural compounds in cabbage, including anthocyanins and glutamine, that have documented anti-inflammatory properties when applied topically. The cool, moisture-rich leaf also draws heat out of inflamed tissue through evaporation. Modern hospitals across Europe have actually rediscovered this. Maternity wards in Britain and Germany now routinely recommend cold cabbage leaves for breast engorgement in nursing mothers, and lactation consultants in American hospitals quietly recommend the same. A head of cabbage costs $2 and treats inflammation for an entire week. The pharmaceutical equivalent is an anti-inflammatory cream that runs $16 a tube and contains compounds that come with their own list of side effects. Number 16. Garlic-infused olive oil for ear infections. When a child came down with an earache, your great-grandmother did not have an antibiotic to dispense. She crushed 2 cloves of fresh garlic, dropped them into a small jar of warmed olive oil, let them steep for 10 minutes off the heat, strained the oil into a clean spoon, and put 2 warm drops into the child's ear with a tilted head. Within an hour, the pain eased. Within 2 days, the ear infection was usually gone. Garlic contains a lysine, a compound with documented antibacterial properties active against Streptococcus pneumoniae and Haemophilus influenzae, the 2 organisms responsible for the majority of childhood ear infections. The olive oil softens earwax and creates a barrier that reduces inflammation. A study published in the journal Pediatrics in 2003 found that an herbal eardrop preparation, including garlic, was as effective as the leading prescription anesthetic eardrop for relieving ear pain in children with acute otitis media. The cost of 2 cloves of garlic and a tablespoon of olive oil is roughly 9 cents. The pharmaceutical version is a prescription that requires a copay and a doctor's visit. 3 generations of American mothers raised children on garlic oil before the prescription pad replaced the kitchen pantry. Here is what nobody is going to tell you in a doctor's office. The reason these remedies vanished from American medicine is not because they failed. It is because in 1910, a man named Abraham Flexner published a report funded by the Carnegie Foundation and the Rockefeller Foundation that proposed a complete restructuring of American medical education. Both of those foundations had massive financial investments in the emerging pharmaceutical industry. The Flexner report resulted in the closure of more than 75 American medical schools. Within 15 years, almost every school that taught botanical medicine, homeopathy, eclectic medicine, or the practical herbal pharmacology that rural doctors had used for generations was shut down or forced to convert to a model that emphasized synthetic drug therapy. The schools that survived produced doctors trained almost exclusively in the new pharmaceutical paradigm. Within 30 years, the knowledge of plant medicine that had been the standard practice of American physicians for 2 centuries was effectively erased from professional training. It did not disappear because it was wrong. It disappeared because it was unprofitable. Your great-grandmother kept it alive in her kitchen because she had no choice. The next remedies on this list are the ones the institutions worked hardest to make sure you forgot. Number 15, the mustard foot bath for fever. When a child ran a high fever in 1920, your great-grandmother filled a wooden tub with water as hot as the foot could tolerate, dissolved 2 heaped tablespoons of dry mustard powder in it, sat the child on a chair with their feet in the water, wrapped the legs in a wool blanket, and let them soak for 15 minutes. The fever broke within the hour. The mechanism is documented in basic physiology textbooks. The hot water and mustard cause vasodilation in the blood vessels of the feet, which draws blood downward from the head and core, lowers core temperature, and breaks the fever cycle. The mustard adds a counterirritant effect that increases circulation further. This was such a standard treatment that it appeared in Army medical manuals through both World Wars and was taught in nursing schools across the country until the 1960s. 2 tablespoons of dry mustard cost about 15 cents, the same physiological effect achieved by a bottle of liquid acetaminophen costs $9 and works through a chemical pathway that places measurable strain on a child's liver. The mustard foot bath has no side effects. It has no overdose risk. It has been forgotten almost entirely. Number 14, the steam tent with thyme and eucalyptus. When somebody in the family came down with a chest infection or stubborn cough, your great-grandmother boiled a large pot of water, dropped in a generous handful of dried thyme and a few sprigs of eucalyptus, if she had them, set the pot on the kitchen table, draped a heavy cotton sheet over the patient's head and the pot, and made them breathe the herbal steam for 10 to 15 minutes. The congestion broke up. The cough became productive. The infection cleared. The science behind this is not subtle. Thyme contains thymol, a documented antibacterial compound that is still listed in modern pharmacopoeias as a topical antiseptic. Eucalyptus contains eucalyptol, which is a measured mucolytic that thins respiratory secretions. The hot, moist air opens the airways and delivers the volatile compounds directly to the inflamed tissue. The United States Army included this exact treatment in field medical manuals through the Korean War. The cost was the price of a handful of dried herbs that grew in any kitchen garden. The modern equivalent is a humidifier, which costs $40, plus a bottle of essential oil that costs another $15, plus a chest decongestant that costs $8. And the combined effect is no better than what your great-grandmother accomplished with a stockpot and a bedsheet. Number 13, slippery elm bark for sore throats and stomach ulcers. The slippery elm tree grew across the eastern half of the United States, and your great-grandmother kept a small jar of its powdered inner bark on the pantry shelf. When somebody in the family had a raw throat, an irritated stomach, or what we would now call acid reflux, she stirred a teaspoon of the powder into a cup of warm water with honey and gave it to them 3 times a day. The relief was immediate and lasting. Slippery elm bark contains a compound called mucilage, a complex polysaccharide that swells in water and forms a soothing protective coating over inflamed mucous membranes. The Cherokee taught this remedy to early settlers, and it became one of the most widely used home medicines in 19th century America. It was so well established that the United States Pharmacopoeia listed it as an official medicine through 1960. Modern research has confirmed it has measurable effects on inflammatory bowel conditions and gastric ulcers. A pound of slippery elm powder costs $12 at a herb shop and lasts a year. The pharmaceutical equivalent is a bottle of liquid stomach medication that costs $9 and lasts 2 weeks. The tree is still standing. The bark is still effective. We just stopped reaching for it. Number 12. Yarrow leaves to stop bleeding on a fresh cut. Yarrow grew along every roadside, fence line, and meadow edge in rural America. When your great-grandfather sliced his hand splitting wood, or a child came running in with a deep cut from a barbed wire fence, your great-grandmother stepped outside, picked a small handful of fresh yarrow leaves, crushed them between her palms, and pressed the green pulp directly onto the wound. The bleeding stopped within seconds. The Latin name for yarrow is Achillea millefolium, named for the Greek hero Achilles, who reportedly used it to treat the wounds of his soldiers in the Trojan War. The compound responsible is achillene, a documented coagulant that promotes blood clotting on contact with broken skin. Yarrow also contains chamizoline, an anti-inflammatory and antimicrobial compound, active against several common wound pathogens. Modern wilderness medicine courses still teach yarrow as a frontline first aid plant. The plant grows in every state in the lower 48. It costs nothing to harvest. It costs nothing to dry and store. The pharmaceutical alternative is a sterile bandage and a liquid styptic, which together cost about $6 and require a trip to the store. Your great-grandmother had a yarrow patch by the back porch. Number 11. Elderberry syrup for the flu. Every fall, your great-grandmother walked the fence rows with a bucket and stripped the ripe black elderberries off the bushes that grew wild across rural America. She brought them home, simmered them with honey and a stick of cinnamon for half an hour, strained the dark purple liquid into glass bottles, and stored them in the root cellar. When somebody in the family came down with the flu through the winter, she gave them a tablespoon of elderberry syrup 3 times a day. The fever broke faster. The cough subsided sooner. The illness ran its course in 5 days instead of 10. This is not folklore. A study published in the Journal of International Medical Research found that elderberry extract reduced the duration of influenza symptoms by an average of 4 days in clinical trials. The mechanism involves anthocyanin, compounds that interfere with the influenza virus's ability to bind to host cell receptors. A jar of homemade elderberry syrup made from forage berries costs essentially nothing beyond the labor of picking. A bottle of commercial elderberry extract at the modern health food store costs $24 and contains the exact same compound. The bushes are still growing. The recipe is not lost. It just stopped being passed down. This is where the story gets genuinely uncomfortable. The American Medical Association lobbied throughout the 1920s and 1930s to discredit what was then called eclectic medicine, the school of practice that combined botanical pharmacology with conventional treatment. Eclectic medical schools had operated successfully for nearly a century, training thousands of physicians who used herbal preparations alongside emerging pharmaceuticals. By 1939, every eclectic medical school in the United States had been forced to close. The textbooks were pulped. The teaching was abandoned. Within one professional generation, the institutional knowledge of how to use botanical medicine in clinical practice was effectively wiped out of American medicine. Your great-grandmother kept it alive at the kitchen table because the academic institutions had decided it no longer existed. The next remedies on this list are the ones that survived only because grandmothers passed them down quietly, away from doctors who had been trained to call them ignorant. Number 10. Mullein leaf tea for chronic cough. The common mullein plant, with its tall yellow flower stalks and soft fuzzy leaves, grew along every American roadside. Your great-grandmother dried the leaves on screens through the summer and stored them in paper bags hung from the kitchen ceiling. When somebody developed a chronic cough that would not break, she crumbled a tablespoon of dried mullein into a teapot, poured boiling water over it, let it steep for 15 minutes, strained it carefully through a cloth to remove the fine hairs, and gave it to the patient, sweetened with honey. The cough loosened, the chest cleared. Mullein contains saponins, mucilage, and a compound called verbascicide, which together have documented expectorant and anti-inflammatory effects on bronchial tissue. The plant has been used in European and American folk medicine for over 2,000 years, specifically for respiratory conditions. The United States Pharmacopoeia listed mullein as an official medicine through 1916. Modern herbal pharmacopoeias still listed as a primary remedy for chronic bronchial inflammation. A single mullein 20 cups of tea. The pharmaceutical equivalent is a bottle of cough suppressant that costs $8 and works for less than 4 hours. Number 9. Goldenrod tea for kidney and urinary problems. When somebody in the family had urinary discomfort, kidney pain, or what your great-grandmother would have called a sluggish bladder, she walked to the meadow, gathered a small bundle of goldenrod flowers, dried them on a screen for 2 weeks, and made them into tea, 2 cups a day for 3 days, and the symptoms typically resolved. The mechanism is well documented. Goldenrod contains saponins and flavonoids that have measurable diuretic and anti-inflammatory effects on the urinary tract. The plant is so well established as a kidney remedy that it remains an officially listed medicine in the German Pharmacopoeia, where physicians prescribe it routinely for mild urinary tract infections and kidney support. Most Americans believe goldenrod causes their late summer allergies, but that is actually ragweed, which blooms at the same time. Goldenrod pollen is too heavy to be windborne and almost never causes allergies. The plant has been smeared by association for decades. Meanwhile, in Europe, it remains a standard remedy. A handful of dried you walk outside. The pharmaceutical equivalent is a urinary tract antibiotic that costs $45 and disrupts your gut flora for weeks afterward. Number 8. The castor oil pack for joint pain and inflammation. When your great-grandmother had a swollen knee, an aching back, or any of the joint pains that came with a hard farm life, she folded a piece of clean wool flannel into a square, soaked it in warm castor oil, laid it directly on the affected area, covered it with a piece of plastic sheeting or oilcloth, and placed a hot water bottle on top. She left it on for an hour, 3 or 4 times a week. The pain eased. The swelling went down. Edgar Cayce, the early 20th century health practitioner, made castor oil packs famous in American folk medicine, but the practice predated him by centuries. The mechanism involves ricinolic acid, the active compound in castor oil, which has documented anti-inflammatory effects when absorbed through the skin. A 2011 study published in the Journal of Naturopathic Medicine confirmed measurable reductions in inflammatory markers in subjects using castor oil packs. A bottle of castor oil costs $7 and lasts 6 months of regular use. The pharmaceutical equivalent is a topical anti-inflammatory cream that costs $14 a tube and has documented systemic side effects when used long-term. The castor oil pack has no side effects. It just takes more time, which apparently was the only thing that mattered. Number 7. Switchel, the apple cider vinegar tonic for digestion. Every Depression-era farm kitchen had a jug of switchel on the back porch through the summer. Your great-grandmother mixed 2 tablespoons of apple cider vinegar with 2 tablespoons of honey or molasses, a half teaspoon of fresh ground ginger, and a quart of cold water. She drank it before meals. Field hands drank it during haying season. It was the original electrolyte drink, and it doubled as a digestive tonic that prevented the bloating, indigestion, and acid reflux that came with a heavy farm diet. The mechanism is exactly what your great-grandmother understood it to be. The vinegar increases stomach acid production in people who have insufficient acid, which improves digestion of protein and fat. The ginger has documented anti-nausea and anti-inflammatory effects. The honey provides quick glucose for working muscles. Modern gastroenterologists at major teaching hospitals are now publishing papers on the role of dilute apple cider vinegar in managing functional dyspepsia, which is the medical term for the kind of indigestion your great-grandmother treated for 2 centuries. A gallon of apple cider vinegar costs $4. A bottle of acid reflux medication costs $35 and comes with a warning label about long-term magnesium deficiency. The switchel jug needed nothing but a back porch and a pantry. Here is the financial logic that explains everything on this list. The pharmaceutical industry generated revenues of approximately $1.5 trillion globally last year. The herbal supplement industry, which is the regulated commercial version of what your great-grandmother grew in her garden for free, generated around $80 billion. The unregulated home production of plant medicine, the kind that takes place in a kitchen with a teapot and a strainer, generates exactly $0 for any corporation. There is no economic incentive for any institution to teach you how to make medicine from a roadside plant. There is enormous economic incentive to convince you that the medicine in your roadside plant is dangerous, unproven, or inferior to the patented compound on the pharmacy shelf that costs $40 and was extracted from the same plant. Your great-grandmother was not poisoning her family with folk remedies. She was operating an unlicensed pharmacy out of her kitchen, and the only thing that ever made it stop was a generation of advertising that convinced her granddaughter the kitchen was no longer the right place to make medicine. The next remedies on this list are the ones that prove the point. Number 6. Comfrey leaf poultice for bruises, sprains, and broken bones. Comfrey, called knitbone in Old English country medicine, was the standard treatment for any musculoskeletal injury, short of a compound fracture. Your great-grandmother grew it at the edge of the garden and used it constantly. When somebody had a deep bruise, a bad sprain, or a slow-healing fracture, she crushed a handful of fresh comfrey leaves, mixed them with just enough warm water to make a green paste, spread the paste on a clean cloth, and bound it directly onto the injured area for several hours at a time, refreshing it twice a day. The healing was visibly faster. The bruising cleared in days instead of weeks. Comfrey contains allantoin, a compound with documented effects on cell proliferation and tissue regeneration. Modern research has confirmed that allantoin accelerates wound healing and bone callus formation. The compound is so effective that it is still used in commercial wound care products and skin care formulations sold in pharmacies today, just at a fraction of the concentration that Comfrey naturally provides. A single Comfrey plant through a season. The pharmaceutical equivalent for soft tissue injury is an anti-inflammatory cream that costs $18 a tube and addresses pain rather than healing. Number 5. Chamomile tea for children's sleep and anxiety. When a child could not settle at bedtime, was running a low fever, or had what your great-grandmother would have called a colicky stomach, she made a weak chamomile tea, sweetened it with a little honey, and gave it warm in a teacup. Within 20 minutes, the child relaxed. Within an hour, they were asleep. Chamomile contains apigenin, a compound that binds to the same brain receptors that anti-anxiety medications bind to, but with a fraction of the side effects. It also contains compounds that relax smooth muscle in the digestive tract, which addresses the colic. A study published in the Journal of Clinical Psychopharmacology found that chamomile extract produced clinically meaningful reductions in generalized anxiety disorder symptoms in adults. Pediatricians in countries where chamomile remains in common use, including Germany, Italy, and Mexico, recommend it routinely for childhood anxiety and sleep problems. American pediatricians, by contrast, are far more likely to recommend a synthetic antihistamine that has documented effects on cognitive development. A box of chamomile tea costs $4 and contains 30 doses. A pediatric prescription for sleep difficulty involves a copay and a controlled substance. Your great-grandmother had a chamomile patch by the kitchen door. Number 4. Cayenne pepper in honey for heart and circulation. This one always sounded extreme, but it was completely standard in Depression-era American medicine. When somebody in the family had cold extremities, slow circulation, or what your great-grandmother would have called a weak heart, she stirred a quarter teaspoon of dry cayenne pepper into a tablespoon of honey and made the patient swallow it once or twice a day. The relief was immediate. The cayenne caused vasodilation, which increased peripheral circulation and warmed the entire body within minutes. Dr. John Christopher, an early 20th century American herbalist who published widely read medical guides, taught that a tincture of cayenne pepper could stop a heart attack in progress if administered quickly. The mechanism involves capsaicin, the active compound in hot peppers, which has documented effects on cardiovascular function, including improved circulation, reduced blood pressure in chronic users, and protective effects on heart tissue. A 2017 study from the American Heart Association found that regular consumption of chili peppers was associated with a 13% reduction in cardiovascular mortality. A jar of cayenne pepper costs $3 and lasts a year. The pharmaceutical equivalent is a daily prescription that costs hundreds of dollars annually, comes with a list of side effects long enough to fill a magazine page. The pattern by now should be obvious, but here is what makes it almost impossible to argue with. Every single remedy on this list works through a documented physiological mechanism that modern science can fully explain. None of them are mystical. None of them require a leap of faith. They were tested by 10,000 grandmothers over hundreds of years using the only randomized controlled trial that ever really mattered, which is whether the family lived through the winter or did not. The remedies that worked got passed down. The ones that did not work were quietly forgotten without anyone needing to publish a paper. The system selected for what was effective with brutal honesty. We replaced that system with one that selects for what is profitable and then we were told the new system was scientific. The last 3 remedies on this list are the ones that prove your great-grandmother understood pharmacology better than the marketing department of any pharmaceutical company that ever existed. Number 3, sweet birch and willow bark for pain and fever. This is the one that ends the argument. Your great-grandmother did not have aspirin because aspirin had not been invented yet, but she had something better. She had a willow tree in the yard or a sweet birch on the back 40. When somebody had a headache, a fever, or muscle pain, she stripped a piece of inner bark from a young willow branch or a sweet birch twig, simmered it in water for 20 minutes to make a strong tea, and gave it to the patient. The pain went away. The fever broke. The mechanism is not interpretation or extrapolation. It is identical. Willow bark contains salicin, which the body converts to salicylic acid. Sweet birch produces methyl salicylate directly. Salicylic acid is the exact compound that the Bayer chemists synthesized in 1899 and patented as aspirin. Aspirin is willow bark with a logo. It is the same medicine your great-grandmother brewed for free, formulated in a slightly different way so that a German pharmaceutical company could sell it back to her granddaughter for $50 a bottle. The active compound is identical. The effect is identical. The only difference is who profits. Native Americans had been using willow bark for pain relief for at least 2,000 years before Bayer's chemists got around to extracting it. Your great-grandmother boiled the bark. Her own great-grandmother had taught her to recognize the tree did not stop growing. The medicine never stopped being effective. It just stopped being free. Number 2, sage tea for sore throats, night sweats, and menopausal symptoms. Sage is one of the oldest medicinal plants in the European and American tradition, and your great-grandmother grew a sage bush by the kitchen door, specifically because she used it constantly. For a sore throat, she made a strong sage tea, let it cool to warm, and used it as a gargle 3 times a day. For night sweats and the hot flashes of menopause, she drank a cup of sage tea twice a day. For digestive trouble, she added a sprig to bone broth. The mechanism is real and well documented. Sage contains compounds including thujone, camphor, and rosmarinic acid that have documented antibacterial, antiviral, and hormonal modulating effects. A 2011 study published in Advances in Therapy found that sage extract significantly reduced the frequency and intensity of hot flashes in menopausal women, with results comparable to hormone replacement therapy. A modern hormone replacement prescription costs hundreds of dollars annually and carries documented risks, including increased breast cancer incidence. A sage bush costs nothing after the first plant is established and produces medicine for 30 years. The Latin name for the genus Salvia comes from the verb to save, because European herbalists understood that sage saved lives. We grow it in pots now and use it in turkey stuffing. Your great-grandmother used it to manage some of the most difficult medical conditions a woman could face, and she did it with a teapot. Number 1, the kitchen as the family's first medicine cabinet. This is the one that connects all of the others, and it is the most powerful idea on this list. Every remedy you have just heard came from a kitchen, a garden, a meadow, or a tree growing within walking distance of the house. The pantry stored the medicine. The garden grew the medicine. The roadside provided the medicine. The forest contributed the medicine. Your great-grandmother did not have a separate room called a medicine cabinet because every room in the house was effectively a medicine cabinet, and every plant in walking distance was effectively a pharmaceutical company. She did not need a prescription because the system was distributed across her entire life. She did not need health insurance because the medicine cost almost nothing. She did not need a doctor for 90% of what ailed her family because she had been trained from childhood to recognize, prepare, and administer the treatments that worked for the conditions that affect ordinary human beings 90% of the time. The doctor existed for the 10% of cases that exceeded household competence. And that was exactly what a doctor should be for. We did not lose this system because it failed. We lost it because in a single generation, between 1920 and 1960, a coordinated campaign of advertising, regulation, professional restriction, and curriculum revision systematically replaced household medical competence with commercial medical dependency. Every remedy on this list was deliberately framed as backward, primitive, dangerous, or unscientific in publications, funded directly or indirectly by companies that stood to gain from its replacement. The campaign worked. Your great-grandmother's pharmacy got dismantled in your mother's lifetime. The plants are still growing. The recipes are still in old books. The compounds are still effective. What got lost is the understanding that a competent adult is supposed to be able to handle most of what life throws at her body without owing money to a corporation for the privilege. Try one this week. Just one. If somebody in your house comes down with a cough, make the steam tent with thyme. If someone gets a small cut, find a yarrow plant in your local park and remember what it looks like, even if you do not need it today. Buy a head of cabbage, peel an outer leaf, crush the rib with a rolling pin, and put it on a sore knee for an hour, and decide for yourself whether your great-grandmother was being primitive or whether she was being smarter than we have given her credit for. Tell me in the comments which remedy you remember from your own family. Tell me what your grandmother used when somebody got sick. Tell me the name of a plant she grew specifically because it was medicine. I promise you somebody in your family tree knew at least 5 things on this list, and the knowledge did not die. It just went quiet. It is time to start listening again.